Hi everyone, thank you for joining our webinar today, Technology and Young People's Mental Health, Perspectives from the Royal College of Psychiatrists. I'm excited to introduce our speaker, Dr. Dubicka, who will be hosting this webinar today. Dr. Dubicka is qualified in medicine and psychology at University College London, completing child psychology training in Manchester, UK, together with a doctorate in adolescent depression at the University of Manchester, where she is an honorary reader. She was an adolescent unit consultant for over a decade, working with young people with complex mental health problems, and in 2018 moved to Pennine Care Foundation Trust, Greater Manchester, where she is helping develop crisis services for young people and is a research lead. In 2017, she was elected chair of the Royal College of Psychiatrists Child and Adolescent Faculty, which involves regular advisory work on policy and child mental health. She has a research interest in mood disorders and brief interventions, has been involved with several large depression trials, and is currently an investigator in the STADIA study, which aims to improve the detection of emotional disorders. She has been a member of the National Institute of Health Research, is the deputy editor on child and adolescent mental health, publishes and speaks regularly in the media and at national and international conferences. She has led on several reviews for the Royal College of Psychiatrists, including the use of technology and self-harm in young people. Thank you so much for joining us today, Dr. Dubicka. Before I let you begin your presentation, I just wanted to remind everyone to send your questions in the chat, and we will try to get to as many as possible at the end of the webinar.
Thank you for inviting me. It's always a bit strange to talk from my study here in Manchester in UK, not quite knowing who my audience is and who's listening out there. So I thought I'd show you some pictures first of all. So it's always nice to see where people are from. So this is Manchester, which is the north of England in the UK. So that's the University of Manchester, where I'm partially based, up at the top there on the left. On the bottom there, it's the BBC down in Salford Quays in the Manchester area. So some of you might know about Manchester from football. I'm not particularly a football addict, but we also do have other cultures like the BBC down here. I work, but I'm also a mother, and one of my kids, he's into kirigami and origami, and he did this lovely cutout of our Manchester Town Hall, so I just thought I'd put that up there as well. So that's where I am, and welcome to this webinar wherever you may be. So in terms of what I'm going to talk about, I'm going to talk a little bit about the background to child mental health issues in the UK, and some of the controversy in the UK around social media and technology, and how that led us at the Royal College of Psychiatrists producing a position statement earlier this year. I'll say a bit about the response to that and a bit about future directions in the broader picture. So social media and technology is often referred to as the good, the bad and the ugly. And as we know, there are amazing opportunities, otherwise I won't be sitting here talking to you thousands of miles away across the Atlantic Ocean. But as you also know, in recent years, there's been lots of concerns about potential harms as well. Just a bit of information in terms of how much young people use do online activities. It's been estimated that there are about 1 billion people, children, young people online worldwide, which constitutes about 1/3 of internet users across the globe. And the issue for us really is that the digital world tends to treat all users equally. However, the digital world is not optional for children and young people. Many of them are now users, and they're often treated the same as adults are. Potentially, children and young people got the most to gain from this new technology. Of course, they're the new generation that have grown up with it, potentially also the most at risk. And we know for every opportunity, there might be a potential risk as well. So is there this justified so-called moral panic around this new technological revolution? That's what I want to talk about today. The only thing that you need to know about this particular graph in terms of a bit of background is that this is a picture of European countries, and the orange bar going across the top there is the UK. So as you can see, we're one of the top users of the internet across the whole of the European Union. And I just want to sort of give that as a context in terms of what's happening to our children in terms of their technology use and also their mental health. There's been lots of reports in recent years about the well-being of children in the UK. Unfortunately, there's not been great news a lot of the time. Here's a very recent study that was published by the Children's Society, and that looked at how the UK compares to 24 other European countries. And we're also top of the league here, in fact we're bottom of the league. So we came out as 24th of 24 European countries in terms of our children's life satisfaction. And that graph there shows you what's happened to children's life satisfaction over the years, and it's not gone in a good direction. And in particular, the fear of failure is much higher amongst the children living here in the UK. And this is ironic because we have had all this increased connectivity. And despite this increased connectivity, we're also finding that our children, young people, are feeling more and more lonely. So the top line there is from another government survey published recently, where about 1 in 5 of our teenagers who live in cities often feel lonely, which is again very ironic because we're one of the most highly connected countries across Europe. Also, another government survey published fairly recently showed that of older teenagers and young adults, the majority of them feel that social media creates an overwhelming pressure to succeed. And in terms of what's happening to our mental health disorders, this is our fairly recent government prevalence survey, the first one done in 15 years, which tracks what's happened to emotional disorders over the past decade or so. And of course, this was during the time of an explosion in terms of our digital technologies, and you can see emotional disorders have increased. Of course, you cannot say at all that correlation means causation, and any good scientist knows that. And of course, there might be plenty of other reasons why our emotional disorders have gone up in children and young people. For example, the global recession and austerity measures in this country, for one. Another very shocking finding from this particular survey was the rates of self-harm in old teenage girls, and there's been lots of studies verifying the findings here. So if you look at those dark blue bars, the one on the right there is girls with mental health disorders, the dark blue graph, the dark blue chart, sorry. And as you can see, more than 50% of older girls with a mental health disorder have self-harmed or attempted suicide, and that's a really shocking statistic. Questions were also asked about social media use within this study. Of interest here, if you look at the dark grey colour on the right of your screen here, on the top there is children, young people with any mental health disorder, and you'll see that about 30% of our children, young people who've got a mental health disorder will spend more than 4 hours a day on social media, and that's compared to about a third, 12% of those with no mental health disorder. So those children, young people are spending much more time online, and of course that's just an association. We don't know what direction that goes in, whether children with mental health problems are seeking out things online, or whether being online they're finding things that are disturbing and then that they develop mental health problems. We have no way of knowing from this particular data. However, questions were also asked about what children, young people think about social media, how it might affect them. And every one of these cases, you'll see the dark blue colour represents those children, young people with a mental health disorder. And in each case, it's much higher than those without. So, for example, children, young people with a mental health disorder are much more likely to compare themselves to others on social media. They're much more likely to be affected by likes, comments and shares, which impact on their mood. They spend more time than they'd like to, and they struggle to be honest about their feelings online. Another study in the UK here is our suicide study, which is run by the University of Manchester and looks at the tragic cases of children, young people who have taken their own lives. And as you can see from the top line there, it's the teenagers who are much more likely to have experienced suicide-related internet use prior to them taking their own lives, 26% versus 13% of those in their 20s. So that's quite a lot of concerning data and figures there. However, at the same time, there's been an awful lot of other research studies that have come back out. There's been lots in our media. Here's one particular newspaper report. There's been many, many like this. So there have been many studies that have found that they've found very little effect at a population level in terms of our children's well-being when they look at screen time, for example, this particular study looked at. And there's been lots of studies that have come out and found similar things to this. However, I guess one of my concerns as a child psychiatrist who deals with the most vulnerable children, young people, has been very little data that's looked at the most vulnerable children in our society. So, you know, I'm not really that surprised if you give out a questionnaire measure, ask teenagers to fill it out in terms of how much time they spend online and how happy or sad they feel, you know, at a population level. I don't really think that's going to tell us very much. So what I'm much more interested in is how it affects the most vulnerable children in our society. And this was another case of a very tragic young person called Molly Russell, who took her own life. She hung herself a few years ago, and her family, her father in particular, have been campaigning around the images that are on social media and how that might have been implicated in her death. And as you know, there's been other things in the media, such as 13 Reasons Why, and how those sorts of images might affect the most vulnerable young people in our society. So there hasn't been much data on vulnerable young people, but here's a study that has looked at this particular group. There's a paper that was published of a survey a couple of years ago, and it was summarised in this report here that came out just this week, Vulnerable Children in a Digital World. So what this particular survey did, it looked at particular risks, and these are fairly standard risks that are examined of young people's experiences online. So they involved contact risks, another word, high-risk online relationships involving sexting, content risks, so visiting or being exposed to websites that are potentially harmful, such as those around anorexia or around self-harm or promoting hatred, etc. Or conduct risks, so behaviour within chat rooms, looking at adult material, visiting gambling online sites, etc. And then lastly, cyber scams, which involve the abuse of personal data, such as hacking, etc. So this survey was done in 2014, which is some time ago, in the, which is, you know, 6 years is a long time in terms of digital media, by Assam and Katz. And the offline vulnerabilities they were looking at were those of family, for example, looked after children, not living at home, children with physical vulnerabilities, those with special educational needs, communication needs, and those with mental health difficulties. And they looked at about 3,000, largely teenagers, and they found that over time, any of these vulnerabilities significantly predicted more risk experiences online. So their conclusion was that children, young people who are vulnerable offline, that vulnerability also extends to their online lives. But the controversy has been quite considerable over in the UK. I don't know what it's like in the US where you might be listening. So a couple of years ago, our Royal College of Paediatrics and Child Health published their report on technology and children, and they reported not finding any evidence that it was toxic. However, they did produce guidance for how screens should be used for under 18s. So I guess they felt there was some justification in terms of monitoring and perhaps sometimes limiting the amount of time children spend online. Following that, our chief medical officer looked at all the evidence, and although they felt the evidence was not conclusive, they did advise a precautionary approach to the use of screens. And then our Parliamentary Science and Technology Committee did quite an extensive report looking at this topic, and again they found the evidence was limited, but they did report that they felt social media amplified some of those risks that children were experiencing offline in their online lives, and that we needed a joined up approach to try and manage this. Some of the other issues they pointed out, and you see this across many of the academic publications, is that screen use, screen time is often so poorly defined. And the issue is far more complex than just how much screen time a child might be having. They're spending all their time looking at educational material, for example. That's very different from somebody who might be scrolling anorexia sites or sites around self-harm or gaming prolifically, using loot boxes, losing a lot of money. So that, that hasn't often been differentiated. Some of the more recent reports have tried to look at that in much more systematic detail. And then the problem with any systematic reviews, it often includes data from some time ago where the definition was very, very poor. Also, many of the previous studies have just looked at simple scales of self-reporting, relying on self-report from children and young people, and that often constitutes underreporting. So, for example, if you ask adults how often they check their screens a day, the numbers will be pretty low, but on average it's been shown as at least 85 times, and that was several years ago. And what's much more important is how screens are used. So it's the context of screen use, who's using it, in what conditions, under what supervision, and what children might be doing on it. Got much greater impact than just quantity alone. And too much of the research just focused on quantity. So at the moment, we still have very limited understanding of who might be at risk and how from the academic publications. Soon after that, the World Health Organization also published guidelines for very young children, and they also adopted a precautionary approach. So their advice was for babies under the age of 1, screen time is not recommended at all. For toddlers, they recommend the less the better and a maximum of 1 hour. And their conclusion was that the potential benefits of reducing sedentary screen time outweighed any possible harms and might also increase health equity by improving health outcomes. So that all led us to developing our own paper, because we were being asked so often in the media over here, because there's been a lot of interest for us to comment on what we thought about the use of screens and technology and social media in children and young people. So we thought we had to develop a position statement of ourselves. And this is freely available online. So if you just Google the Royal College of Psychiatrists and technology use and mental health of 2020, the paper will come up. I'm not going to go through it in detail because it is quite an extensive publication. It was only a scoping review because we didn't have the facility to do a full systematic review. However, we did include some 200 or so publications within that. And my colleague Louise Theodossi was very instrumental in helping me, along with many other colleagues in academic institutions in the UK. We wanted very much to focus on the content and context, which we felt hadn't been addressed previously. We do acknowledge and talk about the potential benefits, of which there are many, but I'm not going to go through these right now because I wanted to focus more on what we thought were areas that were potentially harmful, should be given more consideration. So we do discuss the growing evidence base, and in particular also around addiction and emerging brain studies looking at brain development and cognition. We also conclude that a precautionary approach should be advised, particularly for vulnerable groups, such as those with mental illness, young people in care, and very young children. We acknowledge that technology is not a principal driver of mental illness in children and young people. And for example, poverty, social inequalities, and abuse are much stronger drivers. However, we agree with the previous reports that technology can then amplify some of these risks online. And we make extensive recommendations for families, parents, clinicians, policymakers, etc. One of our main conclusions and recommendations was that tech companies should share their data for research within an ethical framework, and also that there should be a tax levy upon the companies, which should then be used for research and for improving online experiences for children and young people. And that received a lot of media attention. So, I mean, I was very surprised about this, but we did make global news. We had more than 500 million hits worldwide, including from the New York Times, Washington Post to the Times of India. So many people were interested in what we had to say. And that's our BBC in London down there. So I spent a lot of time doing many media interviews on that particular day. I'm just going to pick out a few aspects of the paper that we covered. I think this publication here from World Psychiatry was published last year in 2019 from my colleague Joe Firth, who works here at the University of Manchester, was particularly interesting. And he examined in a review not so much the effects on mental health per se, but how the online brain might be developing in the age of the internet, how the internet might be changing cognition, in particular that of children and young people. Again, much of this research is still very much in its infancy, but this paper looks in detail at how constant information might impair attention, you know, the so-called media multitasking, and affect memory skills, how excessive internet use might impair brain and verbal development, and produces some evidence around that. And then discusses the whole issue of social media and the public acceptance of it, and the public recognition of acceptance and rejection on social media, and how that might affect children and young people. Because in the old days, when I was growing up, this would happen in the playground. It would, you know, it wouldn't happen in the public forum that it happens now for, you know, for many, many people to see. Things like friend requests, likes, upward social comparisons can all result in very negative evaluations of the self, and potentially increase the risk for anxiety and depression. and particularly again in those vulnerable children, young people. We look at many systematic reviews within our publication, just highlighted a couple here, which also points to some of the complexity that you'll find within the research. So here's one by Marchant on the left, looking at self-harm and suicidal behaviour. And they concluded, looking at all the papers that they examined, that internet addiction high levels of internet addiction was associated with self-harm and suicide behaviour, including high levels of internet use and websites that promoted such content. And they talk about other harms, such as the normalisation of this effect amongst peer groups, and that's something that I've seen working in an inpatient unit for many years. You know, how cutting and then ligating became the norm for many young people who were then exposed to that kind of behaviour amongst others, how it could trigger this sort of behaviour in vulnerable young people, how there would be a competition and the so-called contagion effect. And again, that's something I've experienced in clinical practice and certainly in more recent years. But also, as we know, there's also massive potential to exploit the benefits of the internet. And again, there's been more recent studies that have been published around this, which has shown that peer group support can be quite difficult sometimes, that young people can experience an adverse effect on their mental state and the way they might be self-harming sometimes when they're exposed to this within peer groups, but also it's a huge source of support for many young people as well, and particularly if they're feeling lonely and isolated. It also provides opportunities for crisis support, to reduce social isolation, as I've said, and the delivery of therapy and outreach. So it's a very complex scenario. Similarly with social media and depression, so many of the studies that looked at this now point to a very complex bi-directional relationship. So if you are feeling depressed, you might be seeking out content that might reinforce some of that depression online. However, you might also not actually be depressed at the time, but might be vulnerable to depression, and they might be adversely affected by things that you find. And many factors combine to highlight this vulnerability. So, for example, individual vulnerabilities in young people, social isolation, not having family support, peer support. And I see that in my clinical practice. For example, I recall a young person saying to me when they're feeling down and they're self-harming, they are very negatively affected by some of the stuff that they see online and in social media with their peers, and that aggravates their self-harm. However, on the other hand, when they're feeling their depression is much better and they're feeling much stronger, they use these peer support networks support and help other young people and help their friends try and prevent them from self-harming. So it's a very complex relationship, and we do need better studies over time and to look at the complexities of this. Other people have also written about how these risks can be amplified in vulnerable adolescents. There's a paper here in Nature by Candice Olgers, and she recently also reviewed this area in JCPP. This was data looking at data from the States at the Common Sense Media website. They reported that teens from lower income households spend about 3 hours more a day on screens compared to higher incomes. And other studies, here's the European study below, has also found that wealthier parents are much more likely to have the time to actively mediate young people, their children, who do use screens. So again, it points to that social inequality. We talked briefly about addiction, and there's lots of controversy around whether there is such a thing as social media disorder. Most recently, internet gaming disorder has been recognised. But still the concept of internet addiction is in its infancy, certainly in the UK. Over in places like South Korea, it's been recognised for a long time, and the government has set up internet addiction centres there. This is an attempt by one particular group to try and develop a measure to look at this. They looked at 3 Dutch samples who were in their teens, and they report disordered levels of social media use to be around 10%. And they based this on current definitions of addiction. So they developed a scale which looked at whether the young person was constantly preoccupied about social media, developed tolerance, in other words, needed more and more time on it, looked at withdrawals, so felt bad when they couldn't use social media, whether it was persistent, so that it kept trying to spend less time but failed, whether it displaced other activities, whether it could be considered problem use leading to regular arguments because of it, whether They regularly lie to their parents and friends about social media time, whether they use social media to escape negative feelings, and whether it resulted in other serious conflicts with families. This particular group then went on to do a longitudinal study. So they had a group of children, teenagers here actually, and measured them 3 times annually. And they found mixed results, which is often the pattern of many of these studies. So on the one hand, they did find that disordered use of games and social media had a negative impact on life satisfaction over time. Disordered gaming had a negative impact on perceived social competence over time. And that frequent use of social media also predicted a reduction in school performance over time. However, they also found that frequent use of games and social media had some positive effects on perceived social competence. What they didn't also look at is potentially some of the other issues around gaming, for example. So, you know, how many of these kids might be using loot boxes, how much money they've used. So again, these sorts of studies only look at a small snapshot of what might be going on the internet. So the overall conclusions from the existing research is that the systematic reviews are limited by data, and since we wrote our paper, there's been quite a number of other systematic reviews, but the issues are the same. So for example, if you're including studies that look at TV viewing from 10, 20 years ago, you are not asking the right sort of questions that are relevant to the sorts of issues that we're thinking about today. Interactions are complex, and so we need much more sophisticated studies over time, looking into both benefits and harms across a range of use, from occasional use to very heavy use, and looking at the content, the context, and vulnerable groups in particular. And we have to move this debate away from screen time and time spent, except possibly in very young children who might be particularly vulnerable to that. We need better data in real time, and again, the social media companies have got access to that, and we need much better measures than one-off self-report scales. And we should also be asking children, young people about their experiences, and again, particularly the most vulnerable groups. And we should also be looking at brain effects and cognition development and developmental stage over time. And lastly, looking at any impacts of regulation. The question is, the conclusions always are with research studies and academic papers, and we need more research. But the question is, how long do we wait for better data? We know that social media and technology is rising exponentially, and we just cannot keep up with the rate at which that's progressing. It takes years to design a study, to get ethical approval for a study, to get the funding in place, to collect the data, then to analyse it, to write it up. It takes a very, very long time, but we have very real concerns already about how young people are using social media and technology and how it might be affecting them. And in particular, around the issue of persuasive design. So as I'm sure you'll know, persuasive design pushes particular behaviours, for example, through endless streams, pushes various notifications. And we also know that particularly with children, that habits learnt very early in childhood can be very difficult to unlearn. And we also know that children, young people are much less able to self-regulate, and they thrive on instant rewards. They can't wait for things to happen. So I would argue that children, young people are particularly vulnerable to persuasive design. And we also know that the business models of technology companies is that children should be spending more and more time, because that's how money is made by social media companies. Time is money. So the more time our children are spending on screens, the more that companies then profit from this time. There are also other much wider reaching concerns around device security, for example, smart toys that can stream, around privacy settings. But arguably, these technical processes and persuasive design has had much less media attention than content. But arguably, this has got a much greater impact on the safety, security, rights and well-being of children. And sometimes I don't think we've been asking the right questions. This is a group in the UK called the Five Rights Foundation, who I do think have been asking the right questions. They published their internet safety strategy in January 2019 last year. And they talk about rights by design and by default. And they talk in detail about what they think should be happening online for our children, young people. And most importantly, the top one here is about parity of protection. We have standards, we have safeguarding offline, but somehow online, that seems to be a completely different world, and none of those standards seem to apply. Secondly, the design standards should be not around persuasive design, but around safety and privacy and safety by design. Thirdly, there should be much more accountability, transparency, regulatory powers, health warnings and research access to data. Fourthly, enforcement, and I'll come to that in a minute. And, we can't do this alone in silos. There needs to be leadership at government level and globally, because this is a global issue. Education does have a very large part to play. However, it's only part of the answer. We do need to empower children and young people, as well as parents whose skills are often far behind those of their children. But we can't place the responsibility solely on our children and young people. And lastly, we do need evidence-based approaches, but we need the research, but we do need immediate actions as well to protect our children. And one of the strengths of this particular group is they've taken a lot of evidence from children and also from vulnerable groups. And these are the things our children are asking for. They're asking for community rules with enforcement. They want the spread of abuse to be reduced or stopped. They want timelines for reporting. They want to know that something will actually happen if they report abuse online. They want support online. They want content labeling. They want to know what they're going to be looking at. They want guidance on what is a balanced digital life and also about potential risks. They want default settings that support and promote well-being, as well as their privacy. They want transparency, interestingly, on how online platforms make their money from young people. They want to be able to take content down easily, have high default privacy settings. They want to have control of what happens to their digital footprints and be able to revise and review that themselves. So children are telling us quite clearly what they want. And very recently, in fact this month, the same organisation has updated their last report. And what they're calling for now, which I would support, is that there should be child impact assessments on online platforms, revealing any known harms, but also thinking about any unintended consequences and emerging risks. And we should take into consideration the rights of the child from the UN, and that our children do have rights online to be safe. Also, there should be less focus on the sort of service, but more on risks in general, in terms of what's happening online, the regulatory powers we've spoken about, age-appropriate default settings, and most importantly, what are the impact of these algorithms that are used online? The so-called personalisation of the choices you get online, where you get pushed more and more of the same content and go down a particular silo, which could be harmful in itself. For example, the ones that promote suicide and self-harm, personalised choices. And lastly, that risk can accumulate through a series of design choices. Although one particular design choice might seem fairly innocuous, if you have a whole series of particular design choices, risk can then increase through all those choices working together. So what are we doing here in the UK? So the UK has proposed online harms regulation. There is a paper that's out for consultation at the moment. They have proposed that there should be a duty of care from technology companies from children. They have proposed an independent regulator, and that regulation should be proportionate, risk-based and transparent. And we are in consultation with that proposed regulator at the moment. They emphasise the rights of all users. However, it's also important to consider children's rights, but that also has to be balanced against freedom of expression. As you would be aware, there's a lot of discussion around that. But there do need to be robust systems and processes and so-called procedural accountability around all of this, effective ways of making complaint and transparency around decision-making around that, the use of tools such as age verification, and distinguish between illegal content and legal content. So they talk about content that is currently legal but potential for harm. The government is currently suggesting that companies should remove and state what is acceptable. There should be codes of practice, for example, around terrorism, child sexual exploitation. And lastly, the government should be producing regular annual transparency reports and media literacy strategy as well. So that's it summarised in a nutshell, but there's lots of issues, as you can imagine, with much of this. How do you define what is and what isn't acceptable online? How do you define harm? How do you balance these conflicting rights? And the paper's been criticised by various organisations, by the state, for example, by not being specific enough in its regulation. The state then hands over its decision-making responsibility to technology companies, and should we be doing that? Are they best placed to be making those decisions? If you're particularly interested around this and the precautionary principle in particular, at what point do governments need to act and organisations need to act when there's evidence of emerging harms? but the evidence and the data is still short of what we need for, academic evidence. And what happens when you're looking at that evidence, you just still don't have enough of it, but there are high enough concerns what the cost of action is versus inaction, and how policy and politics, the context of that, all interact together. Then do look at this particular paper written by Monahan in Policy Press 2012. For example, we can see that now with the whole COVID pandemic, where we have some evidence, perhaps not enough evidence, but the precautionary principle has been advocated, for example, around mask wearing, and what happens when there are certain political issues driving agendas as well. So when I was preparing for this talk, I also looked at what some people in the industry are saying about this, and John Norton from the University of Cambridge writes about the effects of industry on a regular basis, and he comes from a computer science background, and his own perspective is that algorithms do come with very serious side effects, and we have been far too slow to act on that. I picked up a site here talking about net security, talking about the 7 most dangerous digital technology trends. So many people in industry are also concerned about what's happening, particularly around privacy and around algorithms and cybersecurity. I've just put these pictures up here just to finish off with, because so often people say there is a moral panic. Books came out, there was a moral panic. Rock and roll came out, there was a moral panic. I don't think it's the same. I really, really don't, because technology is growing exponentially at a rate that we've never seen it before, with an incredible way to shape our brains and shape our behaviours and shape the things we do. So when you pick a book, by and large, you could choose what book you wanted to read. You go online, you go on a social media site, all sorts of things come at you that you didn't necessarily choose that you wanted to look at. When you read a book, your privacy wasn't being invaded. So I really don't think that we can make those comparisons. I don't think they're valid. I've put up a picture there of Valium in the pharmaceutical industry and also smoking, because it's unthought of that the pharmaceutical industry, for example, shouldn't be regulated. If you take the comparison of Valium with benzodiazepines, we know they're highly addictive drugs. We also know that the more you sell of these drugs, the more money that the pharmaceutical companies will make. Should we really have left it to pharmaceutical companies to make their own decisions around regulation? And in the same way, social media and persuasive design is set up to be addictive, and it's set up, and the business model is set up so you spend more time online and then the companies make more money. So I think the comparison is very valid. So I and my son, the Royal College of Psychiatrists, feel it's high time that this industry was also regulated. And in the same way, the tobacco industry has been regulated. And again, that's another issue that's discussed in the paper I mentioned earlier, the precautionary principle, and how politics can be set up against the evidence sometimes. So I'm just going to finish off here my final slide, and I'm going to read this out because this was a response to our technology paper. It was an editorial in Lancet Psychiatry in March this year. And although they broadly welcomed our paper, this is what they thought about it. While the Royal College's recommendations might be a useful stopgap, they should only be the start of a process in which mental health professionals and other stakeholders ask more fundamental questions about how and why technology companies operate in the way they do. The impact of these companies must be evaluated beyond the images and memes on social media, and in terms of their effect on the culture and economic balance of society as a whole. If the digital future is to be our home, then it is we who must make it so. Mental health researchers must go beyond standing on the doorstep and asking for donation. They should help to build a better house. And I couldn't agree more with that. So my very, very last slide. When I was researching this, I asked one of my kids just to go and do a bit of Googling and find out what the tech company CEOs do with their own children in terms of how do they monitor online time for their children. And I've got a whole list here. So one of my teenagers made a list on an envelope there, and there are a whole list of different CEOs who do limit time their kids spend online. So Bill Gates and Steve Jobs, we all know about, other techies like Snapchat CEO, they all limit their kids' time online. But the question is why? Why is it that they feel the need to limit their children's time online, regulate what they do? They don't want their own companies to profit from the time their children spend online. However, the most vulnerable children out there don't have the information that they have. So I would really like to have this conversation with them, and I'd like them to share the insider knowledge with us about why they do that. Thank you very much for listening. At the bottom of the page here is MindEd. I just want to point you to that. It's a free resource for anybody interested in mental health issues. It's hosted by the Royal College of Psychiatrists. If you go on minded.org.uk, there's lots of information, free information resource there for professionals and for families around mental health issues. Thank you very much for listening.
Thank you so much for that wonderful presentation. It was a lot of really great information. So we have a little bit of time for a few questions. Our first question is going to be, how do you think that parents or caregivers of children with bipolar disorder or any other mental illness can protect them from potentially being negatively affected by social media or the internet in general?
Hi, of course I wasn't talking about bipolar particularly, but I do appreciate this is an organisation for families where there is bipolar disorder. So do have a look at our paper, because we do give guidance for young people as well as for families. I think the most important thing is it's education and working in a collaborative way with your child. We do know from studies that if you're too boundary, too authoritarian, you know, naturally kids will turn against that. So it's really important to have a dialogue with your child, you know, from when they're very, very little, about what they're doing online, what you know, what they're finding there, and just have a very open and honest conversation about it and keep that going and keep that up. So dialogue is important, and educating yourself as much as you can, as well as educating your children. There's lots of really helpful resources out there online as well.
Okay, thank you. The second question is, how has social media affected adults with mental health problems?
Well, I think the issues, many of the issues will be the same. So the whole idea about persuasive technology will be the same. And you know, so if you're feeling very vulnerable, I often give the example, if I'm seeing a child or a young adult in the clinic, if they're feeling very depressed, they find it really hard to switch off. But if you're feeling stronger, if you're feeling resilient, if your mood's not low, for example, if you've got bipolar, you're not going through a manic episode, and you know, so you're not being impulsive, then it's a lot easier to manage your screen time. What you do, you can turn off that stuff on Twitter or on Instagram that's upsetting you. You can ignore the negative comments. You're not going to do the impulse buying, for example, if you're going through a manic, hypermanic phase. So a lot of the issues are the same. So, you know, and I'll be arguing that we need to be looking after all vulnerable people, children and adults, but clearly children are particularly vulnerable by the fact their brains are still developing as well.
Thank you. And then a couple of the attendees were wondering if they could get digital access to these slides.
I can share that with you afterwards. You can share that.
Okay, thank you. So everyone who was wondering then, I will link those on our website so you can access them from there. And I think that those were all of our questions. Thank you so much for this wonderful presentation.
Okay, thank you very much for listening. Thank you for having me.
Bye-bye.
Thank you.
Thank
Bye-bye.
you. Bye, everybody.
Bye.